Okay, so today's topic is childbirth and postnatal recovery. So what happens the minute you conceive, everybody comes to the doctor asking the same question. Doctor, am I going to have a normal delivery or a cesarean? So please remember, in case you're aiming for a normal delivery, make sure you start preparing from the right day you have conceived. And that is how, by going for your regular antenatal checkups. Take a good diet. Make sure you walk for at least 30 minutes in the morning and 30 minutes in the evening. And you make sure that you go for your prenatal yoga and namaz classes. Towards the end, as you're approaching your 8th month, 9th month, start doing a lot of squatting exercises. Okay, make sure you do those squats as much as possible, or sit in the mal asana as they call. Now, all these efforts put together will lead to a healthy mother and a healthy baby, leading to a healthy, normal delivery. So, next question which the patients usually ask is, when do I come to the hospital? So, what happens? As and when the time is approaching, you will get labor pains. Okay, these pains will start from the back and radiate to the front of your abdomen, going into the vagina or the groin area, and then going into the inner side of the leg. And these labor pains will come at regular intervals, will increase in intensity, and will increase in the duration. It may last for a few seconds earlier, and later on, as the time will pass, it may last for maybe a minute or so. So once the labor pains start and you start feeling the pain, please make sure you also observe that the baby movements are fine. In case if you feel the baby movements are less, and whether there are pains or no pains, or whether you felt the pain at a regular interval or not, please move to the hospital. Now, these pains could be true labor pains or they could be a false labor pains. How do you differentiate between the two? In case the pain comes and it subsides within some time and it reoccurs, maybe say after 8 hours or 9 hours, and it lasts hardly for a few seconds, and again it will subside by taking rest or by taking some sort of a Digene or some antacid. So all these medications may help you relieve the pain. But in case there is a true labor pain, you take any amount of medication, whatever you do, these labor pains will not subside, but they will keep on increasing in intensity, and they will come at frequent intervals as compared to what they were before. Now, somebody can have a watery discharge. As you must have heard in the movies, most of the time, my water broke. Okay, so the baby usually stays in a limited amount of water, which is around the baby. And once the water leaks and there is discharge, then the water left behind is unpredictable. You don't know how much water has leaked out, how much is there inside. So that is the right time. Once you feel the water leakage has started, you move to the hospital. Or if there could be a show. Now, what is show? Usually, once the labor pains start, the amniotic membranes will strip off from the uterus lining. Okay, this is called as stripping of the membranes. When these membranes are stripped from the uterine lining, there is a breakage of capillaries and there will be small amount of blood. Okay, this blood could be maybe brownish in color, okay, which is normally known as show, and it will collect in the cervical canal, or it may pass out through the vagina, and you may feel a brownish color of discharge. But with show, that means your cervix is opening up, it is ripening up, so it is time to move to the hospital. So these are the signs and symptoms when you have to go to the hospital. So one is in case there is decreased movements, or there are labor pains, or there is a water breakage, or there is show. Please move to the hospital. Once you reach the hospital, the doctor on duty will examine you, will differentiate. She will put a NST. She will see the baby's heartbeat. She will record the number of contractions you are having. And accordingly, the consultant will be informed, and the consultant will arrive at that period of time, will examine you, and will tell you, yes, you are in labor, and you will be admitted to the labor ward. Now, once you are admitted to the labor ward, there is frequent monitoring by the NST machine, which records the baby's heartbeat and which also record your contractions. Along with that, intermittently, we'll be doing an internal examination to see whether you are dilating or not dilating, whether the baby's head is coming down or not, and the amount of water which is present. Is it clear? There is no stool of the baby which is passed, which is known as meconium. The baby has not passed any meconium. So all these things are kept into consideration. Now, once the things are going on fine, your labor pains are progressing well, you are dilating well, the baby's head is descending down, the fetal heart is absolutely okay, that is the time when the patient may opt for epidural analgesia. Now, what is epidural analgesia? Usually, some of the patients are very scared of labor pains. Doctor, I will not be able to tolerate these labor pains. I don't want to go in for normal delivery. Please do a cesarean for me. So we tell them there is something known as epidural analgesia, which will give you a lot of relief. Now, how does this epidural analgesia gives you relief? There are nerves which are going into epidural space, and a numbing agent is given. And these nerves which are carrying the pain sensation, these are numbed and you do not feel the pain. Yes, somebody may not feel the pain up to 80%, somebody may not feel the pain up to 90%, and some may not feel the pain up to 100%. So it is like as though you're lying down comfortably. There are no labor pains at all. But after epidural, you'll be able to move around. You can, there will be a continuous monitoring which will be done for you. Plus, a catheter would be put in because you will not have the feeling to evacuate your bladder. So, a catheter is put in to drain the urine so that the urine should not keep on collecting inside. Now, these are the things along with the monitoring and everything. Then later on, once you are ready, the head has come to the, I would say at the vulval region. Okay, it has almost started crowning. The head comes out. So before we give, before the head comes out, so we give a episiotomy over there. Now, what is that episiotomy? It is a cut which is given in the right mediolateral direction. It may be 2 to 2.5 centimeters. And this cut will facilitate the easy delivery of the head and the body of the baby. Once the baby is delivered, we take out the placenta, clamp the cord and take out the placenta. After the placenta is delivered out, the episiotomy is resutured. And if you're under epidural analgesia, then everything is fine. But usually what happens once you're fully dilated, we ask you not to push the button for the epidural analgesia because you won't be able to push out the baby. You will not be able to push the baby. So towards the end, when you're almost maybe 8 to 9 centimeters or you're fully dilated, we ask you not to press the button so that that numbing thing goes away. You are now able to feel the contractions and you will be able to push the baby easily. And thus there will be no need for any instrumental delivery. Otherwise, sometimes when the patient is not able to push at all, and she's not able to take the effort or she's too much exhausted, we may resort to instrumental deliveries. And instrumental delivery could be a vacuum delivery or it could be a forceps delivery. Now, these are what we are talking about, how the delivery normally occurs. But in case, is supposing you are going for your regular antenatal checkups, and then we come to a point where we realize, yes, the baby is a breech presentation, or there is placenta previa, or you are a case who has had previous 2 cesareans, or there was a history of previous myomectomy. So these patients are asked to go in for direct cesarean section. They are not given any trial of labor or anything because there is possibility of the baby's safety. So the baby's safety comes first, the mother's safety also comes. So that is how we decide upon which patients should be taken directly for elective cesarean section and which patients should be left for a normal delivery. But in spite of when you're going through a normal delivery, sometimes it does happen that even though during the labor pains, there could be a fetal distress. The baby's heartbeat could start going down, and there may be a reason why we may have to stop the labor pains and take you inside for a quick cesarean delivery, or in case if the baby has past meconium, stool inside, that means the baby is getting asphyxiated. So we have to deliver that baby as soon as possible. So, and sometimes what happens, even after the full dilatation of the cervix also, the head of the baby does not come down. In such a case, or it comes down to a particular level but doesn't descend further. So in that cases also, in non-descent of head, we may have to resort for a cesarean section. So these are the points when sometimes emergency cesarean section may be resorted in spite of you having good labor pains also. Now, once this is done, we have gone through the labor, the baby has been delivered. Now you're a happy mom. And whether you had a male baby or a female baby, the joy is equally, and you are blessed with a healthy child. Now, once you are blessed with a healthy child, we will come to the postnatal recovery. Now, during the postnatal recovery period, we will divide it into two parts. We will talk about the normal delivery recovery first, and then we'll talk about the cesarean recovery, second part. Normal delivery, you know, everybody, it's an early, easy recovery, and you can breastfeed the baby immediately. Okay, and that is called the minute you start feeding in the 1 hour is also known as the golden hour when you can feed the baby easily. Now, once you have had a normal delivery, you have to look after. You'll be kept in the labor room for at least for 2 to 3 hours to monitor the amount of blood loss that you're having, whether to monitor whether there is any swelling at the episiotomy side or not. Sometimes a bleeder may be left and it can cause a vulval hematoma. So all these things are observed. Once you pass urine post-delivery, the bleeding is normal, your vitals, your pulse, your blood pressure, everything is normal, your saturation levels are fine, then you are shifted to the ward, and there you take care of the baby, and the sisters are there to supervise you and to guide you. Now, post-delivery, once we have given you an episiotomy, so the muscles have become open. Now, this episiotomy has been sutured back after the delivery of the placenta. But to bring the tone of the muscle back, the pelvic floor muscles should come back to its normal place. It should have the normal tone, and you should not feel the looseness of the vagina. So we advise you to do Kegel exercises. Now, what are these Kegel exercises? It is as though if you're going to the market and you cannot find a place to go and urinate and you try to control your urine. That is what you keep the core in tight, nicely tight. So this is known as Kegel exercises. You can try to do that tightening exercise maybe from starting from 10 seconds, increasing to 15 seconds, 20 seconds, and lasting to 1 minute. And you can do it at least 3 times in a day, morning, afternoon, and night. And this can be done without anybody knowing it, or while you're sitting on the chair talking to somebody, doing or standing doing your work. You have to just tighten the lower muscles so that there is no further complications. Okay, the bladder and everything will revert back to its normal position. Now, once this is how a normal delivery recovery usually takes place. But once we come to a cesarean, how does a cesarean recovery takes place? So basically recovery doesn't take too long in cesarean also, but yes, again, your vitals are monitored, your pulse, BP, and everything is taken care of. And we look for whether your gut has started moving or not. The bowel sounds are present or not. Okay, the same thing as we said about normal delivery, we'll monitor your vitals, that is your pulse, your blood pressure, your saturation levels. Then we see, since during a cesarean, spinal anesthesia is given, so a catheter is also put in. So we see the urinary output, and once everything is fine, maybe 2 hours post cesarean, you're shifted to the ward. In the ward also, once there is a gut movement is there, we will allow you with liquid diet. And subsequently, once you pass the flatus, all the gas is released, and then we give you a soft diet. Once that is okay, after a soft diet, then we start giving you a normal diet soon. So it comes in stages, right? The first day you may be on a liquid diet. In the maybe one day or 1.5 day later, you could be on a soft diet, and the second day you could be having your normal diet. The catheter is usually removed maybe after 12 to 24 hours. Okay, the catheter is removed and you're ambulated. You're asked to roam around in the room, take baby steps. Once you get up, make sure you can keep a hand at the cesarean side just to comfort yourself. The initial few steps may be a little painful, but as you get up and walk, sometimes there are certain patients who may say, Doctor, I feel cesarean is far better than a normal delivery. Okay, especially those patients who have had first normal delivery and due to some complication, they had to undergo a second cesarean. Okay, the second delivery was a cesarean delivery. They may say, Doctor, I feel the cesarean is better than a normal delivery. But yes, pain comes in both the cases. In a normal delivery, the pain is before the baby comes out. In cesarean, there is some amount of pain after the baby comes out. But anything which is natural is always good for your health and for the baby also. Now, feeding, as we said, in normal delivery, you're able to feed the baby immediately in the first hour. Maybe after the cesarean, you may be able to feed the baby after 2 hours or maybe after 3 hours, once you have gone back to the room after the post-op recovery period, or if you're in the recovery, then also if you can make an effort, you can tilt on one side and keep the baby and breastfeed the baby. Now, this is how the cesarean post-op care is taken care of. And the catheter, once it is removed, you are asked to go and pass urine, and you'll be able to pass the urine easily. Now, the postpartum care, what happens, since we all know that uterus was everybody's uterus is of their own fist size, okay? Mine would be of my fist size, yours would be of your fist size. That is when you're not pregnant. But once the pregnancy happens, this uterus starts enlarging. And post-delivery, it will come back and start shrinking. But immediately post-delivery, it may come to the level of the umbilicus, which uterus used to weigh around 60 grams initially, may weigh up to 1,000 grams or 1 kg at that moment. And the height of the uterus may be up to the level of your umbilicus. So what happens as and when you start feeding the baby, there is a hormone called oxytocin which is released and which causes contraction of the uterus. Now this contraction of the uterus will cause the uterus to involute, go back to its normal size and shape. This may be associated with some amount of pain. This pain is called the after pains. So sometimes the lady may complain, the doctor, whenever I'm breastfeeding the baby, I feel little pain in the uterus. And especially if you've had a cesarean section, you try to think little extra. There may be something wrong. No, these are the after pains. These are normal. And it usually happens whether you have gone through a cesarean or you have gone through a normal delivery, it will happen either way. So you will feel these after pains, which is very much normal. And the more you breastfeed the baby, the better it will be for you, because one, the baby will get the nutrition, and number two, you will be also able to involute and the organs will go back to its normal size and shape very fast. Now, the bleeding, it happens after delivery. Okay, somebody bleeds for 1 month, somebody bleeds for 1.5 months. Now, this bleeding after delivery is known as lochia And the lochia initially is red in color, which is known as lochia rubra. Then it becomes yellowish in color, which is known as lochia cirrhosa. And later on, it becomes white in color, which is known as lochia alba. Now, in case you that you have to use pads while you're bleeding, it would be preferable that you use cotton pads. Do not use synthetic pads. What happens if you use synthetic pads? Imagine applying a synthetic pad regularly for 20 days, you'll land up with a local infection. And in summer, especially when you're sweating and you've been told by your in-laws or somebody or your family members to cover your head, make sure you cover your head, do not put on the fan. There are so many restrictions. So according to that, you will be losing a lot of sweat, and that sweating and the local area using a synthetic pad, you may land up with some amount of infection, and usually it is a fungal infection. So it is advisable to use cotton pads as much as possible. There are post-delivery pads which are available, lochia pads as they are called. You can take it and use those lochia pads. Since the bleeding is going to last for 30 to 40 days, so make sure you look after the perineum properly. You can use an antifungal powder to smoothen out that place or use medication, but after the discussion and examination by your doctor, not on your own because you're breastfeeding the baby. Now, sometimes what happens, you may have heavy bleeding. Okay, there will be passage of clots, and these clots you may have to change your pads frequently. Maybe you might be changing your pads very soon. Okay, every half an hour or every 15-20 minutes, you're changing a pad. In such a case, do not sit down and do not give a call to your doctor. Please go to the hospital, visit the doctor, let the doctor examine you, and let the doctor see there is no amount of secondary infection. Sometimes what happens, the ladies may use the pad for a very long time, and this can also lead to secondary infection and which may give you heavy bleeding. So you may require some hemostatics or may require some antibiotic depending upon your situation. Now, after delivery, since what happens, some females will complain of the doctor, I have a swelling on my face, there is swelling on my feet, my hands have got swollen. Now, why does that happen? During the pregnancy time, there is a lot of blood volume which increases during the pregnancy time. Now, this blood volume is for the baby, okay, to give nutrition to the baby and supply nutrition via the placenta. Now, what happens once the baby is out, the placenta is out, this blood volume is recirculated in the body, and that is why you feel a swelling that is there present on the hands, face, and feet. But as and when you pass urine and you're sweating and you're breastfeeding, this swelling will also subside. It may take 3 or 4 days for some people, or for some, it may take up to 10 days also. So slowly and steadily, this swelling will also subside. Now, breastfeeding. When you're breastfeeding the baby, okay, make sure you clean your nipples properly. Every time you're breastfeeding the baby, even if you have to feed the baby every 2 hourly, make sure you keep a bowl of a cotton which is soaked in water, and you can clean with the normal cotton and water normally, or keep a wet tissue, I would suggest. Clean it so that there is no sweat, nothing goes inside the mouth of the baby. And you start feeding the baby. Feed the baby every 2 hourly or feed the baby on demand feed, depending upon how your baby wants and how much milk is needed for the baby. Because every baby's demand will be different depending upon the baby's weight. Now, once you are feeding the baby, you make sure that you feed the baby for at least for 20 minutes from each breast. And sometimes you may have to feed the baby for a longer time also. So you alternate between both the breasts. Why? Because what happens, initially there will be a watery sort of milk which will come out, which will satisfy the thirst of the baby. And later on, there'll be a thick milk coming out, which will satisfy or fill the tummy of the baby. Now, in case if we are alternating, we are giving 20 minutes on this side, 20 minutes on the other side, what happens? Both the time the baby is just taking the water part. The thin milk is going in. Now, once the thin milk goes in, the baby's thirst is quenched, but the baby's appetite is not gone. Is not full. The tummy is not full. So the minute you put the baby back to bed, the baby will start crying again. So that is the reason what happens and why you feel that the baby keeps on crying. Once I've breastfed the baby, I put the baby back to bed, it keeps on crying. It keeps on crying because the tummy is not full. So you may have to supplement with a top feed also. Now, since you are feeding the baby and there is a demand feed of the baby, that is fine. The nipples are taken care of. And sometimes what you can do is there is a hind milk which is coming out. You can take some of that hind milk and clean the nipples with that also before you go in for the next feed after you have breastfed the baby. Now, it is best that you breastfeed the baby as much as possible. You should try and breastfeed the baby minimum of 6 months and a maximum of 2 years. Okay, but if 6 months, why? Because 6 months the baby is totally dependent on the breastfeed. Baby does not require any water, nothing. It is only mother's breastfeed which is required. Now, one more complaint which most of the women will do post delivery is the backache. That I have a lot of backache, and especially if you have gone through cesarean section, it is because of the spinal anesthesia, that needle that got inside my back, or if you have had epidural analgesia. No, because of the epidural analgesia, I was feeling the pain. It is the needle which has caused me the pain. No, it is not that. It is the posture. What you do is observe yourself, okay, or ask your relatives to observe you. When you're breastfeeding the baby, most of the women will hunch, will slouch down, okay. They will tend to go to the level of the baby, but make sure you put some pillows and lift the baby up so that the baby comes closer to you rather than you going down upon the baby. So make sure that your posture is correct and that it is your vitamin D loss from the body, your calcium loss from the body, because some of the females or some of the patients after delivery may not take their iron and calcium supplements. They think, no, 9 months has been enough. We have had enough number of medication. We are not going to take any further medication. But those are a real must after delivery. Why? Because they will prevent you from early bone loss. Okay. And if not taken calcium properly, especially while you're breastfeeding, you may land up into early signs of osteoporosis. Now, so your posture has to be maintained. And once you're walking, also remember you walk in a erect posture. Why? Because during pregnancy, the center of gravity had changed. Okay, you were walking with your tummy protruding out. Now again, the baby is out. The center of gravity again changes. So all these postural changes, which happen naturally during the pregnancy time, will also give you some amount of pain, and these are compensated by taking those supplements. But just in case, one person, if the pain does not go, please contact the physiotherapist. There are physiotherapists available in the hospital. They will guide you. They will tell you certain poses to be done, certain exercises to be done, and your backache will go away with that. Now, last but not the least, it is the baby is there, you're home, everybody is joyful, everybody is enjoying, and everybody wants to be in and around the baby. So what happens? In the morning, the baby is off to sleep. In the night, the baby is awake. So this change of routine is impossible for some females to adjust to. What happens in the morning? You have some household chores to be done. There may be some guests or relatives coming at home to congratulate you. But in some cases, what will happen? You are awake in the night also, feeding the baby. You are awake in the daytime also, looking after the relatives, looking if you have an elder child, looking after your elder child, doing your household chores if you're a nuclear family. So all these problems can happen, and this leads to baby blues or the postpartum blues. In certain circumstances, there may be emotional burst out. You may cry at any point. You may feel rejoiceful at any moment of time. So all these things are normal for a few days since you are adjusting to your new routine. Once you have adjusted to the new routine, it is fine, and you will be happy, and you will try and find out a midway that when it's the baby sleeps, you also sleep along with the baby, and once the baby is awake, you get up and do the course for the baby. Now, what happens if this thing lasts for too long? By chance, if it extends for more than 1.5 months and 2 months, then it is a time because you're going into a postpartum depression. You may become irritable, you may not eat anything, you may lose interest in your life, you may feel suicidal attempts could be there. So, all these thoughts may come into you that your life has become worthless. You are not uh, doing anything up to the mark to make anybody feel happy, and these depressive thoughts keep on increasing. So that is a time when you should contact your doctor, and with the help of the doctor, get in touch and make sure you get out of this postpartum depression as soon as possible. So these are the few points that we should know about a delivery process and about postpartum recovery. Noreen, you want to say something?
Uh, no, doctor, thank you so much for explaining the topics. We can now take up the questions from the participants. Yeah.
Okay, so one of our first questions is a participant that is 36 weeks pregnant and the baby is currently in the transverse position. Is there any chance that it will still move into cephalic?
Usually after 36 weeks, very rarely the baby moves until and unless you are a case of polyhydramnios where there is excess amount of water around the baby, then there could be a 1% chance the baby may move. But usually after that, the baby does not move.
We have a participant that is 33 weeks pregnant and the baby is in breech position. The doctor recommended duck walks. Will it help to change the position of the baby?
33 weeks, you can easily wait. 33 weeks to 37 weeks, anytime the baby can turn around and the position of the baby can turn back to cephalic. But once the baby is cephalic, make sure you get an ultrasound done to see is there any loop of cord, one loop or two loops of cord. Because if the baby is moving so much, it may usually get tangled with the loop of cord. If it is a single loop, you need not bother. But if it is a double loop, then obviously you have to take care.
Is it possible to avoid episiotomy? And
Is it
how
possible
much
to
does
avoid?
episiotomy?
Yes, there are few countries which are coming up and they are trying to avoid episiotomy, but for that you need to do perineal massages. Make sure you won't be able to do it yourself. You can ask your husband to do it for you. We can start with one finger and go on to 3 fingers at the most. You can avoid episiotomy if it is a second delivery, but if the perineum is too tight and you're a first time delivering, delivering a baby, or you're a primary gravida, as we say, then usually the perineum is too tight and you may require a episiotomy.
The follow-up question on that, if you could not prevent or avoid that episiotomy, how much does it hurt post-delivery and how long does the healing take and the stitches to be healed?
Usually it takes 7 days for the stitches to dissolve, but the pain will go off immediately if you do a proper care. That is, you take a sitz bath. Sitz bath is basically you take a basin and put in some warm water, put in few drops of betadine solution and sit in that so that there is amount of hot fermentation which goes to the episiotomy side. Sitz bath can be done. You can clean the episiotomy after passing urine, after passing motion. Every time, make sure you clean the episiotomy properly and while cleaning, make sure you are moving from the top direction to the bottom, not from the stool portion to the front. Don't ever clean like that. From urinary area to the stool area, your hand should move, and post that apply a ointment. Usually we give a antiseptic ointment to be applied post the sitz bath. And the pain, usually if you are doing some amount, a little bit of Kegel exercises, the pain will go faster.
Is normal delivery with the epidural and C-section delivery the same intention in getting back pain in the future?
No, I didn't get you. Normal delivery, what?
With epidural or a
Uh-huh.
C-section delivery, is it the same intense feeling, and are you going to get back pain in the future as a result of having an epidural?
No, after epidural, you are back to normal within 2-3 hours only. There is nothing of that sort. And after cesarean, you're back after 24 hours because that is a spinal anesthesia and this is epidural. If the patient is under epidural anesthesia, and sometimes you may have to take the patient for cesarean, then usually the anesthetist will ask us, you want us to do the cesarean under epidural? If you can wait for 15-20 minutes, then it's okay. But if we are under a very big emergency, and if we say no, the fetal heart is really dropping fast, we need the baby out immediately, then the anesthetist will resort to spinal anesthesia.
There is a belief that our elders told us to drink only room temperature water. Is it okay to drink slightly cooler or sometimes chilled water? Or do we have to drink room temperature
Usually warm
water?
water will facilitate a lot of absorption. Okay, it will help to absorb food. So that is why the reason why usually the parents or the in-laws or the elders in the family would advise you to drink warm water. But okay, you can take a lukewarm water. There's no need to drink very hot water, but there's no need to drink too cold water also. The reason why they ask you to cover your head and take lukewarm water is all that because initially what used to happen, people never used to take their multivitamins. They never used to go for antenatal checkups. So you were prone to more amount of infections and everything post-delivery. Since nowadays the deliveries are happening in the hospital, you're covered up with antibiotics if required, and you're given a proper nursing care and everything. So there is no amount of infection, and you can take that thing. Matter you can take lukewarm water. There is no need for too cold water or too warm water.
Our next participant said that she had a previous cesarean section and she now wished to try vaginal birth after cesarean. The doctor told her that they will induce her at 38 weeks. Will it work? She is worried that it will repeat.
See, there are a lot of factors which matter into this. One is, what is your Bishop score? How is your pelvic finding? Why the cesarean was done earlier? If the baby was in the breech position, then obviously, if you had a cesarean now, if the baby is cephalic and everything is favorable, then obviously you can go in for a normal delivery this time also. And it is not necessary once a cesarean, always a cesarean. You can always try a vaginal delivery after cesarean also, which is very, very common.
Our one participant said that last week the doctor told her that she is 2 centimeters dilated. She's currently 37 weeks. How long can you stay at 2 centimeters of dilation before it can progress?
See, it depends again from person to person. You can pull for 1 week also, but if you do a lot of exercises, a lot of squatting, sometimes even maybe you may come back the same day in the night with labor pains. If the doctor has already done sweeping and stretching for you, that is like stripping of the membranes from the uterus, which will release prostaglandins, will help you to go into labor faster. Obviously, you may come back to the delivery ward earlier, but if she has just examined you, you are a second time delivery first baby you've already delivered normal, you could be 2 centimeters and you can go on with 2 centimeters for a week or 10 days, depending upon how active you are.
At 37 weeks pregnant, if we suddenly start to have light itching in the arms and the legs, is that something to be worried about?
Yes, it is something to be worried about. What happens is your liver enzymes are getting deranged. So it is known as interstasis, cholelithiasis of the pregnancy. So in that cases, we have to get your liver function test done and serum bile acids done. If they are out of range and they are too much out of range, you may be asked for a early induction of delivery. So early delivery may be advised for you by your doctor.
We are almost running out of time, so I'm just trying to screen for the crucial
Okay.
questions. You have answered some of them already. 39 weeks pregnant, the belly becomes extremely tight at this stage. Is this a sign of labor if there is no pains at the moment?
No, stretching may be there. The stretching of the skin would be there because if your baby weight, the amount of volume, all these things will depend. If supposing you're carrying a 3.5 kg baby weight with good amount of liquor inside you, there will be a lot of stretching. You may feel as though your skin is going to tear apart, but there could be no labor pains at all also.
Okay. I delivered a week ago, but I still have issues with passing a bowel movement. How can I overcome this situation?
Okay, she feels constipated all the time. Maybe the amount of water that you're drinking is too less. The diet you're taking may not contain enough amount of roughage. So make sure you do that. Increase the water intake. Take more amount of fruits like papaya, pineapple, which were contraindicated earlier. Now you can easily take those fruits. And obviously those fruits you can take during the end period also. You can start from 37 weeks onwards, so that it helps in releasing and going into labor. So yes, these things you can do, and make sure in case even after doing home remedies like this, you are not able to evacuate your bowel, then you come to the doctor. There are certain medications which can be given to you and you will be able to have easy evacuation.
We're going to have a moment for one last question. I've looked at the second last question at the moment. What is the remedy for dry and cracked nipples? Does it make any problem after delivery when it comes to breastfeeding?
See, dry and cracked nipples, there is an ointment by the name of Nip Care. You can apply on those nipples. And once as you start, there is secretion, the breast milk starts secreting, and you know the hind milk will come. You can rub that hind milk, and that hind milk will make the breast soft and the nipples soft and supple. And obviously, the nature also takes care. Around the nipple, you will see small brown glands which are there. Prominent glands will come up. This will release some amount of oil, and this will look after the nipple parts.
Doctor, we've come to the end of this session and we need to wrap it up. Thank you so much for your knowledge and the way that you presented all this to our participants. To our participants, those questions that we did not get to, please populate that on your community link and we will make sure that we answer your questions. It was lovely having all of you this evening and I wish you a beautiful evening. One last parting wisdom that you want to leave us with, Doctor?
Yes, please make sure you exercise well, you eat well. Do not eat junk food, please. With eating junk food, you land up with a lot of complications during the pregnancy and unnecessary problems. So have a healthy diet, exercise, and be mentally prepared for a pelvic examination. Because everybody wants a normal delivery without the doctor touching her.
Yeah.
So you should also mentally prepare yourself how a pelvic examination is done. So once you're going to your doctor, make sure you ask her, doctor, how will you be doing my pelvic examination? And ask your husband to do perineal massages for you.
Doctor, thank you so much.